Empyema. Anatomy. The pleural space or cavity is a region in the chest cavity that lies between the visceral pleura, the membrane on the outside of the lungs, and the parietal pleura, the membrane lining the inside of the chest wall. Ordinarily, this area contains just a few teaspoons of pleural fluid. With an empyema, this area may instead contain a pint or more of infected, pus-like, purulent, pleural fluid. When there is extra fluid in the pleural space, it is referred to as a pleural effusion. Empyema fluid. The fluid contained in an empyema is referred to as pus and contains a combination of bacteria, dead cells, and white blood cells. The most common bacteria causing an empyema are Streptococcus pneumoniae, the pneumonia bacteria, and Staphylococcus aureus. When a sample of pleural fluid is drained, the cloudy and thick appearance of an empyema is usually quite obvious in how it contrasts with normal pleural fluid, which is thin and translucent. Definition. Empyema is also called pyothorax or purulent pleuritis. It's a condition in which pus gathers in the area between the lungs and the inner surface of the chest wall. This area is known as the pleural space. Pus is a fluid that's filled with immune cells, dead cells, and bacteria. Pus in the pleural space can't be coughed out. Instead, it needs to be drained by a needle or surgery. Empyema is a collection of pus in the space between the lung and the inner surface of the chest wall, pleural space. An empyema is a collection of pus in the pleural space, the area between the membranes lining the lungs, pleura. Risk factors. An empyema is more likely to occur in someone with diabetes, a history of alcoholism, autoimmune diseases such as rheumatoid arthritis, a suppressed immune system, such as with chemotherapy, lung diseases such as COPD and chronic bronchitis, gastroesophageal reflux disease. Causes. There are a number of different conditions which may result in an empyema. Some of these include pneumonia. This is the most common cause of an empyema. Chest trauma, from a fall, motor vehicle accident, or other injury. Chest surgery, such as surgery for lung cancer or heart disease. A thoracentesis. Sometimes an infection may be caused inadvertently when a thoracentesis, needle, tap, of the pleural space, is done to diagnose disease, or when a chest tube is placed to drain air, as in a pneumothorax, or fluid, as in a pleural effusion. A bronchopleural fistula. A bronchopleural fistula is a fistula or canal that may develop between the pleural space and bronchi during lung surgery, allowing bacteria to pass from the bronchi to the pleural space. An extension of infection, an infection in the abdomen, peritonitis, or area between the lungs, mediastinum, may spread into the pleural space. A lung abscess may rupture into the pleural space. Pathophysiology. The development of empyema can be described in a sequence of events. During an inflammatory process such as pneumonia, there is an increase in fluid production in the pleural cavity known as the exudate stage. As the disease progresses, microorganisms, usually bacteria, can colonize the fluid and generated an empyema. This fluid is characterized by elevated lactate dehydrogenase, proteins, neutrophils, and dead cells. Macroscopically is a thick opaque fluid found in the fibrinopurulent stage. After the resolution of the infection and as a consequence of the inflammation, there is a process of fibrosis that can lead to restriction of the lung parenchyma. Appropriate and early intervention is vital to decrease complications and mortality. Signs and symptoms. Empyema can be simple or complex. Simple empyema. Simple empyema occurs in the early stages of the illness. A person has this type if the pus is free-flowing. The symptoms of simple empyema include shortness of breath, dry cough, fever, sweating, chest pain when breathing that may be described as stabbing, headache, confusion, loss of appetite. Complex empyema. Complex empyema occurs in the later stage of the illness. In complex empyema, the inflammation is more severe. Scar tissue may form and divide the chest cavity into smaller cavities. This is called loculation, and it's more difficult to treat. If the infection continues to get worse, it can lead to the formation of a thick peel over the pleura, called a pleural peel. This peel prevents the lung from expanding. Surgery is required to fix it. Other symptoms in complex empyema include difficulty breathing, decreased breath sounds, weight loss, chest pain. Diagnosis: history taking. Take a complete medical, surgical, family, socio-economic history. The presentation may be similar to pneumonia, and cough, sputum production, fever, and pleuritic type chest pain may be present. Patients with empyema may have symptoms for a more extended period. Physical examination. Carry out a complete physical examination. Use a stethoscope to listen for any abnormal sounds in lungs. On physical exam there may be a dullness to percussion on the affected area, agophonia, increased palpable fremitus, and fine crackles. However, symptoms and physical exam findings are unspecific. Imaging studies. Chest X-rays and CT scans will show whether or not there's fluid in the pleural space. Ultrasonography. An ultrasound of the chest will show the amount of fluid and its exact location. Blood tests. Blood tests can help check white blood cell count, look for the C-reactive protein, and identify the bacteria causing the infection. White cell count can be elevated when patient has infection. Thoracentesis. During a thoracentesis, a needle is inserted through the back of your ribcage into the pleural space to take a sample of fluid. The fluid is then analyzed under a microscope to look for bacteria, protein, and other cells. Medical management. Treatment for empyema can include antibiotics. Doctors usually prescribe antibiotics as the first treatment for simple cases of empyema. Because different strains of bacteria cause empyema, finding the right antibiotic is crucial. Antibiotic treatment typically takes 2 to 6 weeks to work. Drainage. Draining the fluid is essential to prevent simple empyema progressing to complicated or frank empyema. It also helps keep the condition under control. To drain the fluid, thoracostomy procedure is performed, which involves inserting an ultrasound or computer-guided tube into the chest cavity and removing the liquid from the pleural space. Fibrinolytic therapy. It uses drugs known as fibrinolytic agents. The therapy helps to drain pleural fluid, and it may be used in combination with a tube thoracostomy. Surgical management. One study found that a surgery called decortication yielded better results than tube drainage in people with advanced empyema. Decortication involves removing the pus, pockets, and fibrous tissue from the pleural space, which helps the lungs expand properly. There are 2 types of surgeries available. In most cases, a surgeon will perform a video-assisted thoracotomy, VATS. This procedure is less invasive, less painful, and has a shorter recovery time than an open thoracotomy, which requires a surgeon to open the chest. In some cases, however, a surgeon will perform an open thoracotomy. Nursing management. Ineffective airway clearance. Impaired gas exchange. Ineffective breathing pattern. Risk for infection. Acute pain. Activity intolerance. Hyperthermia. Risk for deficient fluid volume. Risk for imbalanced nutrition, less than body requirements. Deficient knowledge. Deficient fluid volume. Complications. In rare instances, a case of complex empyema can lead to more severe complications. These include fibrothorax, respiratory distress, sepsis and a collapsed lung, also called a pneumothorax.
So guys, thanks for watching my video. You can like and comment on my video, but don't forget to subscribe my YouTube channel to watch quality content like this. Thank you guys.